Dr. D from ExploreHolistic.com. Most people occasionally suffer from sinus problems, but they usually go away pretty quickly. However, sometimes they turn into a chronic condition. In this video, I'm going to be talking about what role teeth play in chronic sinusitis and what you can do about it. Let's get started. So, sinusitis, what is it? Basically, it means that you have an inflammation or an infection in your sinuses and is diagnosed based on symptoms. Some symptoms can include postnasal drip, runny nose, blocked or stuffy nose, pain, tenderness, swelling, and pressure around your eyes, cheeks, nose, or forehead that worsens when you bend over. You could have headaches, you could have a sore throat, and there are more. According to the Mayo Clinic, some common causes of sinusitis can be, number one, allergies or hay fever. Then there are respiratory tract infections. There could be infections caused by viruses or bacteria. You can also have nasal polyps. These tissue growths can block the nasal passages or sinuses. You may also have a deviated nasal septum, crooked septum, the wall between the nostrils, which may restrict or block the sinus passages, making the symptoms of sinusitis worse. So how is chronic sinusitis normally treated? According to the Cleveland Clinic, chronic sinusitis is commonly treated by 1. Having you avoid the triggers, first of all, that cause the inflammation in the first place, which are usually related to the allergies and other environmental factors. Use steroid sprays, antihistamines, antibiotics, and decongestants to reduce inflammation. You can also have surgery to correct the structural issues like a deviated septum or to remove polyps. You can do it also by inserting a balloon into a sinus cavity to open it further and make more room. Some treatments sound pretty radical, but what if you exhaust all these treatments and you still have chronic sinusitis? Well, maybe now is the time to investigate whether your teeth actually may be the problem. To understand why teeth may be involved in chronic sinusitis, it's important to touch on a bit of anatomy. There are 4 paired spaces or sinuses that are connected to each other via narrow passages within the skull. These spaces are located above and under your eyes, above your upper back teeth, and they are in close relationship to the roots of your upper teeth. Sinuses function as a filtration system, keeping the nose from drying out, keeps it clean and free of bacteria. They also lighten the facial bones and act as a resonance chamber for speech. Let's take a look at the relationship between the roots of your upper back teeth and the sinus floor. What separates the sinus, which is an empty space, from the jawbone, is a very thin layer of bone. Note that the roots of the back teeth are virtually resting on this thin layer of bone. So here are some possible causes of a chronic sinusitis. 1. During extraction of an upper molar tooth, the sinus floor can be perforated or broken, thus creating an opening into the sinus, which can promote an infection. 2. There can be an infection in a tooth that will cause an accumulation of toxic byproducts at the tip of the root. This space fills up like a balloon and creates pressure on the floor of the sinus, thus causing pressure on the sinus itself. 3rd, a long-standing infection can actually cause the thin floor of the sinus to break apart, exposing the sinus to the infection. 4th, during a root canal procedure, instruments used may perforate the sinus floor, introducing bacteria and unwanted dental materials into the sinus cavity. As well, a sinus can also be perforated during a dental implant procedure. So what do you do if you think you have a chronic sinusitis that might be from dental origin? Well, the first thing you do is go back to your dentist and tell him what's happening and express your concerns. If you feel your dentist is not qualified to address these concerns, check with a biological dentist who will evaluate your problem from a holistic viewpoint. Or go to a qualified oral surgeon, which can be consulted, who may have advanced X-ray imaging tests that can pinpoint the problem and offer correction, such as removing the infected tooth or repairing the sinus floor. Either way, you need to see a qualified practitioner, one who has experience in handling these types of problems. So I hope you learned a little bit about how dental conditions can affect chronic sinusitis and how it can help you find a solution to that condition. Check out our holistic directory to find a holistic dentist or other holistic practitioner near you. Remember to like us, hit that subscribe button, and I'll see you soon. Bye.